Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show. Today, bringing you another really awesome guest involved in creating a better tomorrow for many patients out there. Today, we have the honor of being joined by Dr. Jasneet Bhullar, who is a colorectal surgeon and member of the general surgery team at Ascension Providence Hospital, a part of Michigan State University College of Human Medicine, where he provides both surgical and non-surgical treatments for a range of conditions, including things like pelvic floor disorders, fecal incontinence, colon and rectal cancers, hemorrhoids, and a variety of other complex issues of both the colon and rectal system. Dr. Bhullar is also a practitioner associated with the Cornerstone Medical Group. This is a multi-specialty group associated with Ascension. It consists of primary care and specialty physicians in the Metro Detroit area. There he was responsible, obviously not just for care, but also in earning recognition for that organization as a Medtronic InterStem Center of Excellence for his work, which we'll be talking about on the show with regard to implantable electrostimulation that's also MRI compatible, and some of these interesting novel technologies that have come on the scene recently. Dr. Bhullar earned his medical degree at Gobind Singh Medical College in India, completed residencies in general surgery through Government Medical College in India and also Providence Hospital and Medical Centers, Michigan State University, and he did fellowship work in colon and rectal surgery at University of Minnesota. He's also board certified by the American Board of Surgery and the American Board of Colon and Rectal Surgery. A lot of themes to get into today that we don't normally touch on. I'm really excited about this show. Dr. Jasneet Bhullar, thank you so much for taking the time to come on the show today.
Thank you so much, Ara, and thanks for inviting me.
It's a great having you. I'd love to start off, as we typically do, by handing the floor over to you for a little bit, just to talk a little bit more about you. I noticed, sort of early on in the scientific literature when you started publishing, you weren't only publishing on colorectal medicine, but you were studying things like prostate cancer, breast cancer, pancreatic cancers. Talk a little bit about your background, why medicine, why surgery, and what got you focused on the colorectal system to begin with.
So that's been an interesting journey for me, Ira. And like you mentioned, I did my medical school in India, and then we moved to the US. I did my residency again at Providence Hospital, Southfield, Michigan, part of the Michigan State University program. And after that, went to University of Minnesota at Minneapolis for my colorectal surgery fellowship. Now, University of Minnesota colorectal program, one of the oldest, one of the best known in the world. So it was a privilege to be trained there. And that's where I started to develop a big interest in pelvic floor disorders. My research, like you said, has been for like almost 2 decades now, but it was more for cancer along the while. I was focusing a lot on that. I did basic research. I created the first animal model for colon cancer in a mouse. That means I took colon cancer from humans and basically implanted it into a mouse to replicate. Mm-hmm. So after that, it was just colorectal was the way to go. And then I wanted it to see, not just in the lab, I wanted to see how I can help my patients in real life. And that's where I found this niche of pelvic floor disorders, fecal incontinence, to be the big thing that's missing out there in the community, with a lot of patients needing it and the expertise clearly lacking. And when we talk about these conditions, most people don't even know what we're talking about in fecal incontinence. So if we break it down, it's the involuntary leakage of stool or gas when the patient is not aware. And we can laugh about it, but for those people, it's very serious thing. It's embarrassing. It affects their quality of life. It affects their day-to-day lifestyle. It adds a lot of cost if they have to wear diapers. It's not just the patient who suffers, it's the family which suffers because they don't want to meet, they don't want to go out. So slowly and slowly, it just changes their lifestyle. And we did surveys out in the community. And what we found was 1 in 12 people, unfortunately, suffers from pelvic floor disorders like this. It's just that they don't talk about it, they don't approach anybody, they just suffer in silence. And a lot of time, they just feel, hey, I'm getting old. Maybe that's why. Or even if they talk about it, they're like, nah, you're old. Maybe that's all it is. And they don't even know that there's help out there which can make them help feel better. So I thought, what better could it be if I could do research on this topic, help the patients, create awareness. So that's what I've been working on for a while now.
Excellent. Yeah, it's quite interesting because we have on past shows talked about colon cancer, ostomy care. We even did a show on diarrheal diseases of less resourced countries, talking about things like cholera. But fecal incontinence is one that we had not touched on. And as I was preparing for the discussion with you, I came across that data, and as you were just mentioning, a lot of people, an unmet need. And
True.
then a third component of that, something that we touch on occasionally on the show. Obviously, this ramps up significantly as one gets older, and this whole issue with health span and quality of life later on severely, again, impacting older adults. So a major area, clearly understand why you got involved in it. Could you talk a little bit, and we'll get to sort of sacral nerve stimulation and some of these more modern tools that have come on the scene recently, but talk a little bit about the sort of the evolution of technology in this space, because clearly some of these things, like what we're going to be talking about, or some of these other tools, digestible cameras and implants, whatever, they weren't around until recently.
Absolutely. Absolutely.
Talk about the past, and what's it been like as a practitioner when you have no tools and it's clearly an unmet medical need.
So that's very interesting that you ask about the journey and the embracing of technology for our conditions. So it's two-sided things to it, Ira. One part is that, what medicine and surgery was 20 years ago is not what it is now. And even what it was 5 years ago, it is not what it is now. Interestingly, also, the patient expectations are not now what they were 20 years ago. Our disease pattern has changed. Our longevity has changed. So things that we never saw before, we are dealing with them. And interestingly, this problem of fecal incontinence it affects a lot of people across all age groups, a little more than anybody who's above 50. But I've seen patients as young in their 20s and 30s, some because of surgeries, some because of other medical conditions, some because of how they were born. It's all over the place. And what we were offering them 20 years ago was, hey, maybe you can do some exercises, we can get you some pelvic therapy. Does it work? Not really, but that's all you had. You could give them anti-diarrhea pills, give them some fiber, and hope that the stool would be so hard that it won't leak. So that's all we could do. There were some, sphincter reconstruction surgeries, and they wouldn't last. So we didn't honestly have much to offer our patients in terms of long-term benefits. And that's where the technology started to come around. There was a big need for it. Like I said, hundreds and millions of patients out there needing help. So in 2009, FDA approved sacral nerve stimulation, which we also call as InterStim from Medtronic, a small device which stimulates a very peripheral sacral nerve, which controls the pelvis in layman terms. And they approved it for overactive bladder in 2009. In 2011, FDA approved it for fecal incontinence. And since then, it revolutionized what we offer to our patients. We had multi-institutional studies which came by from 2011 to 14, 15, which showed that this thing was great. It helped patients not only control the symptoms, get them a better quality of life, but more importantly, it kept working. So it's not like you do it once and you're back again in 2 years. This battery would last years and years and would last so long that sometimes we had to change the battery, and these were our happiest group of patients. So this is us embracing technology, helping our patients, and that's what it is. As surgeons and physicians, our patients are premium. So if there's anything I can do, if there's technology out there I have to embrace, so be it. But also comes along the thing that we have to be critical of ourselves. We are the gatekeepers for our patients too. We are answerable to our patients in terms of what I'm offering. Is it critically evaluated? Is it just a gimmick? Or it really does help my patients? I have to evaluate because I'm responsible for my patients. I'm answerable to them. So that's where the research component of such devices, new technology comes in, that we critically evaluate them in real life and say, how much does it help us? How much is it really translating to the quality of life, their symptoms, their expectations? So that's where research, collaboration with industry, as well as new innovation and new technology comes together.
And could you just say, for our audience to be less familiar, can you just give us a couple minute primer on sacral neuromodulation and what exactly is happening in the process, and then we'll segue in a little bit into the MRI
That's a
issue.
good question, and I'm going to break it down in layman terms.
Please.
So sacral nerve stimulation, sacral nerve, it comes away. It's a peripheral nerve. That means it comes away from the spinal cord. So there's no reportable nerve injury that we can talk about. We always do it in 2 steps whenever we are thinking about this device. Our first step is a test phase. That means we place a small lead close to the nerve, and we place a battery to the patient's back, and we tell the patients, go home, and for the next 1 to 2 weeks, you are the judge. Except for taking a shower, go ahead, do whatever you like, and see how it helps your symptoms. There are two kinds of symptoms our patients have. One is overactive bladder. That means they have to get up again and again. And non-obstructed urination. That means we know there's no obstructed, but the bladder won't empty. So there's a urological part of it. And the second part is fecal incontinence. This device helps patients both ways. Fecal incontinence, those who have to rush to the restroom, can't make it in time, or they're walking and they just keep on leaking stool. It helps both of these patients. Some people have both problems. Some people have one each, whichever they may be suffering from. That test phase, they come back and tell me that, I did great. Then we put in the stimulator. It's a small little device which goes underneath the skin on one of the bottoms. And because the patient is a judge himself, we know that this device would help them. And what I've learned with my own experience and what has been in literature, it's more than 90%, 95% across studies that's what helps the patients. But we want to make sure that the patient has the confidence, and that's why we do it in these 2 test phases. How does it work? It basically is stimulating a nerve working separately from our brain, from a higher center. That device is taking over to stimulate the nerve, so it's working 24/7 without the patient being aware of it. If it's the bladder, it's telling the bladder to relax so that they're not rushing, they're not getting up 5 times at night, which disturbs their sleep to pee. They can actually control it better. Fecal incontinence, it's helping. That way, they are not leaking. They can actively do stuff. They can go for hikes. They can go to their social events without having to be conscious about being embarrassed. So that's doing 24/7 for them. And interestingly, the battery life of this device lasts anything from 8 to 12 years. They have this device and they forget about it because now this is the new life that they get as compared to what they were suffering with those symptoms before. So it's a very simple concept and a very simple surgery. It's not even, it's a small procedure that we do as an outpatient. 15, 20 minutes of sleep is what all it takes us to do. So not a complicated surgery, but a big, big change in the patient's lifestyle and what they go through.
So thank you for laying the groundwork on that. And now we'll take a brief tangent and love to discuss the topic of MRI compatibility and just like some of the numbers with fecal incontinence that we discussed at the beginning. There are some other big numbers here. So, just, the brief look at it, somewhere a little over 40 million MRIs currently performed in the United States each year, and a number of around estimated 10% or so of all Americans throughout their lifetime will have at least one device implanted into their bodies. Not always a metallic one, but
Yeah.
a large percentage.
No, you're right about it.
Talk a little bit about the topic of MRI compatibility in general, and then we'll come back to
Sure.
InterStim.
So you gave the numbers, and if you look at it, you would think that, I'm going to need an MRI probably in my lifetime. Odds are I might. It can be for spine problems, it can be for muscle problems, it can be for abdomen, it can be for cancer. A lot of things that MRI is being done, and it's a very good diagnostic tool. Now, you also have an aging population. The population which needs some kind of a device which may, hamper. And what is MRI basically? MRI is a big magnet, which, we put the patient through. Now, if you have something which is metallic, that magnet's going to interfere with that. So that's where the MRI problem compatibility comes when we're talking about anything metallic going into the human body. It can heat it up. It can cause it to malfunction. All those problems comes along with it. So not to delve into any other implantable devices, but I can certainly focus upon this sacral nerve stimulator because I can tell you more details about it. And what happened was, as we talked about, the approval for the InterStim, Medtronic InterStim for overactive bladder in 2009 by FDA and then 2011 by FDA for fecal incontinence. We delved into it and the patients were happy. What we started noticing is that with our aging population, some of the patients would unfortunately need an MRI. And they would come to us. They'll be like, Doc, I need an MRI. They say, we have to get this device out. And with a heavy heart, we take it out. One, it needs a procedure. Secondly, now you have a very unhappy patient because now he is to go through the same symptoms, which many years ago he forgot he ever had it. So they're miserable as much as they want to get the MRI. They are not happy people. And sometimes after MRI, we have to bring them back and put it back in again just to get them back the quality of life. So we were frustrated, as were the patients, that, hey, this could be better. Something has to be, you can't just take somebody's things away and then put them through that agony of going through those symptoms again. So as surgeons, we approached the industry, and the industry, especially Medtronic, embraced it as a challenge. And thankfully, in 2020 August, the new MRI compatible sacral nerve stimulator was FDA approved. That was a game changer because now I can tell my patients with the confidence that I'm going to put this device in you, which I think is going to help you a lot, but I'm not going to see you back for 10, 12 years when you run out of that battery, which is a great amount of time. And if you need an MRI, feel free. You just need to let the technician know so that they can do the appropriate settings, but you can go through an MRI with the confidence that everything's good. So that was a game changer. And we were very happy with it. Patients were very happy with it. Then what happened was that, we had this surgeon mentality of being super critical of ourselves. So we said, all our studies, what we had done on patients, multi-institutional studies way back from 2011 to 16, had shown that this device does great. Reliability is good, complication rate is low, and it works for years. Now we've been given this new device. How can I tell my patients looking at them that this device is at least the same, if not better? I have nothing to support me except for being told that what it is. And we said, this is just not fair. We need data. We need good data to tell us it is better or at least the same. So what we did was, and we thought about it, that it can't be one person telling us that. Right. It has to be multiple institutions, multiple surgeons. So what we did, we took a 2-year period, starting from August of 2020 when this device was approved. And we collaborated, University of Minnesota, which is one of the big implanting centers in the country. I was with the University of Pittsburgh Medical Center back then, and University of Wisconsin, Lutheran Hospital in Chicago, Illinois, and Providence Hospital in Southfield. And we pooled together all the patients who got these implants during that 2-year period, and we followed up the details for each one of them and critically analyzed the data. Once the data came out, I actually presented our findings at FIOD conference. FIOD is Fecal Incontinence and Obstructed Defecation. It's the world's biggest pelvic floor conference held internationally. It was in Rome in November of 2020, and I presented our data there and they awarded it as the best oral presentation because everybody wanted that data. Multi-institutional, something to learn, something to tell our patients. And what we found in our data was that this device was at least as good, if not better, than what we had been using in the past in terms of low complication rate across different institutions, across different surgeons, good patient satisfaction, great outcomes. And that is something that we loved to now go out in the community and say with confidence that, hey, we have this new device, greatly improved in terms of MRI compatibility. Now we have data to show that it works good. It has the same proven reliability, but with better option of getting an MRI done. And we recently published this in World Journal of Radiology, which is one of the top ranking journals. Why we chose radiology was for one reason. One, who's going to do the MRIs? Radiologists. Who need to be aware about it? Radiologists. So that's where it got picked up for that reason, that it creates an awareness. Because otherwise, a lot of people wouldn't even know no, you got a device. I don't listen to you. So now at least it's going out there that it's MRI compatible. These patients can have an MRI. We just need to know about it. So it has made a big change for our patients. It has been a game changer in terms of patient outcomes. Now, especially with the aging population, this is going to help people for many, many decades to come.
Absolutely. And for everybody that's going to be listening, watching the show, the title of the recent paper, which just came out in February 28th of this year, Outcomes and Efficacy of Magnetic Resonant Imaging Compatible Sacral Nerve Stimulator for Management of Fecal Incontinence, a multi-institutional study. And it's an awesome piece of work. It was interesting because I saw, I guess a little bit after this happened, the Medtronic people from the public health group, they congratulate you in social media. They talk about your group, and you're now an InterStim Center of Excellence. And I love seeing it because we profiled also some really interesting guests from Medtronic over the last couple of years on a variety of the technologies they're developing. And this is a great story in the sense it's major medical centers and universities working with the corporate side and ultimately creating safer and more efficacious options for patients. What does it mean to be a center of excellence, and ultimately, how does that then? Because I'm sitting here in Philadelphia, we got pretty good healthcare systems around here, but how does sort of the center of excellence now for InterStim technologies expand? What does it mean, and a little bit of what's happened next for you? It's a good process.
So now that you say about the center of excellence, something I have back here, I'm going to show you that.
There you go.
That's what it means as part of being the center of excellence.
Nice.
So what does that mean for us? It's taken us many, many years, and it's not about us. It's about our patients.
Sure.
We are fortunately the 5th colorectal fecal incontinence center of excellence in the US. And how it gets accorded is by patient outcomes. Obviously, the more number of patients you help, the more patients who get this treatment. Then comes patient outcomes and satisfaction, and also in terms of outgoing research, which we do for it. But what this center means for us is not for us, it's for our patients, because this gives us a platform to go out in the community and create awareness. And like I talked about, a lot of people suffer in silence. They don't tell, they don't talk about it, they suffer, and they basically change their lifestyle. So this is for those patients that now we can reach out and say, there's help out there. It intrigues them, at least gets the conversation started. We started getting phone calls anonymously that, hey, I want to be seen by Dr. Bhullar. And the receptionist would ask, like, why? She's like, oh, no, I just want an appointment. So it took them a little while. They're like, oh, no, you need a referral, da, da, da. So then we said, no, there's something else going on here. So we said, fine, you can talk to him. We won't even charge you. That's fine. Don't worry about it. And we set aside some time for a community. And what it was basically all of this was this. And people start crying. They said, I've been to 3 different colorectal surgeons. I live in a metro town. It's not even like a rural community where the resources are limited. Nobody told me that this thing existed. I said, well, it's not a gimmick. It's been around for a decade and a half now. And they say, when can I sign up? Can you please get me through this? And I still remember this lady I saw about 2, 3 months ago. And she said, I've been to 3 different GIs, 2 surgeons, and I've been told go and do exercises. I'm miserable. I heard about this. I'm glad I did. When can you do it? I said, well, 2, 3 weeks. She's like, can you do it next week, please? So she finagled with my scheduler and we got her in. After it was done, and I saw her after 2, 3 weeks, and I expected her to do well. She was not happy. This lady was angry. And I was like, what wrong did I do? He was like, Dr. Bhullar, I owe you, but I'm not happy at all those people for 7 years who took my life away from me because I was miserable. He's like, if somebody would have guided me, somebody would have pointed me in this direction, I didn't need to miss out 7 years of my life for how miserable I was. And, it just touched me that, she loved me, she loved my staff, but she was just that, she had lost 7 years of her life being miserable, homebound, changing diapers. So that's what the Center of Excellence means for us, is a platform to go out in the community, educate people, our providers even, a lot of primary care, our nurse practitioner friends, our APPs, gastroenterologists, they don't know that this technology has been around, proven to help people. So Center of Excellence is for them. That's for those silent patients who are suffering, and I hope we can help them.
It's interesting. We started our discussion, talking about the past and, seeing the evolution of coming from not a lot of technologies to these technologies to now these technologies which have been optimized, obviously, in this case, made MRI compatible. Let's talk a little bit about the future now, because I noticed that last month at the Society for Surgery, the Alimentary Tract annual meeting in Washington, the topic of your discussion there was current status and role of artificial intelligence in anorectal diseases and pelvic floor disorders. And, AI is a pretty hot topic nowadays. We've done a few shows on it. Love to hear your perspective on where AI is taking us specifically in this segment. Obviously, hey, AI it can help us find this colorectal tumor or this other disorder, or allow us to put the interstim in more properly, or probably do a million other things that I don't know about. But take us into the future a little bit, 2024 and beyond, and other tools too. I mean, it doesn't have to be just AI. It could be digital twins or anything else that is kind of exciting and hot on the horizon. Love to hear your perspective on where the whole space is going.
Let me start first that I'm impressed. You did a lot of digging on me. I did not.
I don't sound like an idiot talking.
Thank you. Thank you. So that I did not see that coming, but yes. So AI is something, and like we talked about, it's there. It's the hot topic, but at the same time, it's technology. And like we talked about, as physicians, as surgeons, we have to embrace technology. It is for the betterment of our patients. We can't just say, oh, I can deny everything. No, I'm a great surgeon. I don't need anything more. That's me talking. It's not, I'm doing the right thing for our patients. So that's why, I'm the program director for Ascension Michigan State University Colorectal Surgery Fellowship Program. So I train colorectal fellows who are fully trained general surgeons and now want to specialize into colorectal. And part of it is my research with them that I do. A part of it is the training, and I make them think that, hey, we got to be super critical. We got to embrace, but at the same time, you have to take it with a pinch of salt. Not everything's going to stay. What needs to stay, we are the gatekeepers for our patients. So AI is something which has come up on our colorectal scanners too. And it is very diverse. I'm already using AI with my colonoscopies. So
Okay.
what that means is there's this big box, which technically is also coming from Medtronic, which was interesting, a totally separate thing from what I do. But what it does is that when I'm doing a colonoscopy, it puts a little box that wherever a polyp is it perfect? No. Am I perfect? No. But between the two of us, I think we can pick up something more than what I would done it alone. That's how I see it. I've seen it an evolution happening with them. It's better than what it was 6 months ago. So it keeps relearning, getting better and better. That's how I see it. What I started doing was looking into what's out there in terms of AI for pelvic floor disorders, fecal incontinence. And what we found was that it would help us select where we are now, select these patients, give us some idea that these ones would help from intervention, these ones probably not, and help us guide it and give the confidence to those patients that, hey, this is a good treatment for you, or this is the other good treatment for you. Of course, the need for a physician or a surgeon is not going to be taken away. We are still the gatekeepers, we are still the guides, we are still the ones who are going to do it. But it's an extra help. It's a confidence from the patient that, somebody who has no bias at all is now going to help us do. So that's what I presented at SSAT is part of Digestive Disease Week. This is the biggest world's collaborative conference of gastroenterologists, colorectal surgeons who come together for almost 1 week, put their heads together about new technology. So it was a great platform that I could talk about this with other leaders in the field from across different countries.
Absolutely. Absolutely. Yeah, it's again amazing, being an outsider, but seeing listening to you and seeing the evolution of the space and seeing the real-time application of these tools that, a couple of years ago were more science fiction or just didn't even exist. So no, it's great to see.
I mean, if you
Dr.
talk about science fiction, I get this question very commonly because, I deal with some of my older patients, talking 50s, 60s, but some going into the 17 and 80s. And I tell them about this device, sacral nerve. They said, so you're telling me there is this little device which you're going to put inside me and it's going to control my butt? I said, technically, yes. So, we have a good laugh at it. He's like, I can't believe this thing. Where did this come from? And these are this really nice group of people. They're like, I could have sworn I could have never thought about this would ever happen. I said, did you ever think you would have a cell phone with a computer in your hand? So,
There you
that's
go.
how things have and how things have changed. And we are there to embrace technology and use it to improve the lives of our patients.
Indeed. Indeed. Um, Dr. Bhullar, while we have you, what else is going on for 2024 that we should know about with regard to you, the Cornerstone Medical Group, Ascension, anything else on your calendar in terms of conferences, talks, or anything else I missed while we have you today? Please take the floor.
Thank you. Actually, 2024 has been a great year for us. We are trying to build up a pelvic floor center for the whole Midwest. And
Yes.
Center of Excellence has been one step along the way. What that means for us is that we want to create awareness in the whole of Midwest that pelvic floor disorders, patients can reach out to us. They can give us a call and they don't have to see me. They can be in Wisconsin and I'm happy to guide them because I want them treated. So it's an awareness thing that we are trying to create as a referral center, not just for Michigan alone, but for the Midwest. And being a center of excellence gives us that little bit of a platform to tell them that, hey, reach out. Don't worry about insurance. I'm here to guide whosoever you may choose to go to. That's not the thing. The onus is to create awareness with the patients, with our primary care providers, gastroenterologists. That's what we are focusing on in 2024. I just came back from ABCRS, which is American Society of Colon and Rectal Surgeons annual conference. This was held in Baltimore, and I got elected as the chair for the international committee. So I'm going to be reaching out across the world with different colorectal societies, collaborating with them, try not just to create awareness, but also to collaborate to grow colorectal programs across countries so that we can, as a global, we can help patients. Uh, I'm traveling to Korea next week. We have
Okay.
endoscopy, that is Endo 2024, the biggest endoscopy conference in the world.
Okay.
We are going to be looking at and presenting our data for detecting early cancers. So a lot going on in 2024, keeping us busy, but that's what we are here for.
Awesome. Really awesome. And we will continue to follow you and watch your incredible work as you bring these innovations to patients and people that need them. And really, just really a great story. And so glad we had the opportunity to hear it, and really wishing you and your whole team there the best with it as you continue to make patients' lives better, and as we say, better tomorrow. Really great story. Again, for everybody that's going to be listening to this episode of our show or watching on our YouTube channel, you've been spending time with Dr. Jasneet Bhullar, colorectal surgeon, member of the general surgery team at Ascension Providence Hospital, also member of Cornerstone Medical Group and their Medtronic Center of Excellence. Dr. Bhullar, I really want to, again, thank you for taking the time out of your schedule to walk us through all these topics. Obviously, thank you for everything you're doing for patients. And as we like to say on our show, thanks for creating a better tomorrow via what you do. Really a great story.
Thank you, Ara. Thank you for inviting me. Thank you for giving me the platform to reach out to people. I love doing it, and I hope I can make their lives better.
Great having you.